Hi, I'm Brian Cott. I'm an upper extremity surgeon at Brielle Orthopaedics. Dupuytren's contracture is a thickening of the tissue just below the skin on the palm and can extend up into the level of the fingers. It may be associated with pits, bumps, and palpable cords. This can be progressive and actually cause the finger or fingers not to be able to fully straighten. The cause of Dupuytren's contracture is unknown. It's more commonly seen in men than women, in patients over the age of 40, and also those of Northern European descent. Dupuytren's contracture is typically diagnosed with a careful physical exam. The signs of Dupuytren's contracture typically involve lumps, pits, and cords in the level of the hand and fingers. This can be identified on a physical examination. X-rays are not often done. Typically, this condition is painless. It can be progressive, causing the fingers to bend closer to the level of the palm and not be able to fully straighten. Occasionally, this condition can be painful with the pressure on these lumps if they interfere with activities. The treatment for Dupuytren's contracture varies from patient to patient. Some people do not like any bend in their finger, where other people can tolerate having their finger bend further. At some point, treatment measures can be considered. This involves an injection that can be placed into the level of the finger to straighten the finger, or, in extreme cases, surgery to remove the scar tissue which has developed. For the injection procedure, typically this is done in the office setting after given some local anesthesia, and quite often patients come back 2 to 3 days later for manipulation. This manipulation is also done in the office under a local anesthetic. Swelling and bruising are common, but finger range of motion exercises can be begun almost immediately. It typically takes 2 to 3 weeks to obtain full motion after a release of this nature. Another option for more severe cases is an operative procedure. This involves removing all of the diseased tissue in the level of the palm and finger. Typically, a splint is applied and physical therapy exercises are started early. It may take 2 to 3 months to obtain full range of motion after a procedure of this nature. Unfortunately, there is a high recurrence rate for Dupuytren's disease after both surgical procedure and an injection. That being said, most patients are very satisfied with their outcomes from invasive treatment.